All right, as it is 12 o'clock, we're going to get started. I like to be prompt and on time and as respectful of all of your time as possible. Just a couple of quick things. I know I just said this a couple minutes ago, and thank you to the family medicine residents for letting us know who's all there viewing with you. If there are multiple people in the room, please let us know who's there so we can make sure that you all get credit for being here and being a part of this. Thank you, Dr. Lynn. I know this is not the world's most exciting topic, and most of you probably rolled your eyes a little bit when you saw it, but the reason why the IRCC, which is our Institutional Resident Curriculum Committee, some of you sit on this committee, the group essentially decides what curriculum, what education we need to provide to every single resident on the Phoenix campus on an annual or on a rotating basis. And work hours is something that comes up over and over again. We still have lots of problems with work hour violations. For better or for worse, there are some people who still don't love talking about work hours, but it is what it is. We have rules put in place by the ACGME, and I don't know about all of you, but I'm a Catholic Girl Scout. I'm a rule follower, and if I don't follow the rules, I feel guilty about it. And so the purpose of this lecture is really to make sure that all of you understand our current work hour rules. They do change. Almost every year there's a slight revision to things. So we're just going to go through kind of what the rules are, what following means, what counts, what doesn't, and what to do if we break them. If you have questions along the way, by all means, please put a question into the chat and we'll make sure that we address it, okay? So just before we begin, when you hear people talk about duty hours, know that about a year ago, the ACGME changed the language and the way that we refer to work hour rules. They used to be called duty hour rules or duty hours, and now they're work hours. Duty periods has been changed to clinical and educational time, and anything that basically is a duty is now considered clinical and educational experience. So it may seem like a worthless change in verbiage, but it's what the ACGME has done, and so we want to be consistent with that. Even I, though, still struggle and say duty hours a few times, so if that happens, please forgive me. So let's talk about why we have rules. There's actually some really good data out there regarding patient safety and fatigue. We all know that folks who have been up for at least 24 hours sometimes test the same as they would if they were an impaired driver or if they were driving drunk. And we know that patient safety events are 3 times more likely to happen if you're fatigued. I don't know about all of you, but I don't function very well when I've been up all night. My attention and my ability to process and to do things is not the same. And so the ACGME recognizes this. Admittedly, some of the ACGME's initial motivation for work hour rules may have been surrounding some events, and it was specifically the case of Libby Zion that happened in New York that was really found to be more having to do with supervision. But regardless, we've had work hour rules since 2004. Over time, they have evolved a fair amount, and for better or for worse, the ACGME has actually gotten more strict in terms of their enforcement and interpretation of them. So the rules by the numbers, and these are our current rules that are in effect that every single one of you has to follow. Resident, fellow, it doesn't matter. 80, no more than 80 hours per week averaged over 4 weeks, which basically means if you don't have any vacation, you can work up to 320 hours over a 4-week period of time. I'm not gonna lie, that's a lot, given the fact that most of the population still works a 40-hour work week. You guys are working twice that. But you can start to see why there's some restrictions on how much you work. 24, no more than 24 hours of continuous clinical duty. So that means 24 hours of being on call and being responsible for new patient care. The ACGME does allow up to 4 hours for activities related to patient safety in terms of a transitional period. So if you're on overnight on a Friday night and you finish your call shift at 7 a.m., you technically have up to 4 hours to wrap anything up for patient care, to follow up on lab results, to finish an admission, to sign out those patients to others. But during that 4-hour period, you cannot be responsible for new patients, meaning if you were post-call and your 24 hours is over, you cannot admit a new patient. You can only be involved in transitional activities related to the patients that you're already responsible for. 14, you have to have 14 hours off after 24 hours on. So if you're on Friday night and you get to leave the hospital on Saturday morning, you technically can't come back for 14 hours, which means If for some reason the way that a schedule was done, you're supposed to come back for a night shift the day after you're on call, you can't do that. You have to have at least 14 hours off after you've been on for 24 hours. You should have 8 hours off between scheduled activities. Now, this has changed tremendously over the years. We used to have must have 10, should have 8. And recognizing that sometimes there's a late case and sometimes things happen, the ACG&E has modified the language here. So technically, it's not a rule, a hard and fast rule. Technically, it's not a work hour violation if you only have 7.5 hours from when you leave, so you've got a really late case, or you have a patient that one of your continuity patients that gets admitted to the hospital that you're finishing their admission for, and you leave the hospital at midnight and come back at 7 a.m., the ACG&E would tell us that that's not a violation unless it happens on a regular basis. But I want all of you to know that our institution treats that as a work hour violation. So you can kind of ignore the should and consider that a must. You must have 8 hours off between scheduled activities, which means if you're leaving really late, by all means, please contact the rest of your team and say, hey, I didn't get out of here until midnight. Technically, I can't come back until 8 a.m. And friends, if anybody gives you a hard time, you tell them Ferguson told you that's the way it is and have them call me and I'll take care of it. 1 and 7, you must have at least 1 day off in 7 averaged over 4 weeks. Now, for most programs, and let's be honest, most of you, it's way better to have a golden weekend where you're off the entire weekend than work every other weekend. That still satisfies the 1 and 4, as long as you have 4 days off over 4 weeks. So theoretically, you could work 24 days in a row out of 28 and then have 4 days off and you would still be in compliance with this rule, though I'm not going to lie, that's not a very great schedule for rest and relaxation. Every program does this just a little bit differently, but you absolutely have to have 1 day off. And this isn't just a day. It is a 24-hour period. So if you only have 23.5 hours off, it is not considered a full day off, for better or for worse, the way that New Innovations monitors our logs, and it will show up as a work hour violation. So you have to make sure that you get at least 24 or 48 hours or however many days you're supposed to have off. It has to be a full 24-hour at least period. And then Q3, in-house call cannot be more frequent than 1 and 3. So if you're on Monday night, you can't be on Wednesday night. Even Thursday night, that's technically considered Q3, but a schedule like that for very long would become intolerable after a while. So there's been a lot of confusion over the years in terms of how work hours are monitored, in terms of what is our actual monitoring period. Some people thought it was the scheduled rotation date. Some people thought it was the month. And so I just want to give you a little bit of a visual of exactly how work hour periods are monitored. So if we're looking at just a segment of the calendar and we look at the 1st of one month through the 9th of the following month, your first monitoring period is the first 28 days of your scheduled rotation. So if your rotation is scheduled to start on Monday the 1st, your first monitoring period is the first in the next 28 days. If your rotation is actually scheduled to start on Sunday the 30th, then your monitoring period would actually be the 30th through the 27th, if that makes sense. So it's 28 consecutive days from your first scheduled date of the rotation. Your second monitoring period is the next 28 days. But what happens to the last 2 weeks of this 10-week rotation? So it actually starts counting backwards from the end of the rotation for an additional 28-day monitoring period. So even though there are only 70 days in this rotational experience, 10-week rotation, there are 3 28-day monitoring periods in it. And your work hours have to work out in all 3 of those monitoring periods. I know we've had some violations in various programs in the past for residents switching weekends that maybe all of their weekends off fell in only one of the monitoring period, and it doesn't matter. You still have to have at least 1 day off, averaged in 7, for all 3 of those monitoring periods. And it does mean that there's a little bit less flexibility for kind of some of those middle dates, but we have to be in compliance with all of the monitoring periods, not just 2 out of the 3. So let's talk a little bit about what counts towards your monitoring or towards your work hours. All clinical activity counts. So if you are at work, pretty much all of the time that you're at work, unless you've decided to stay at work to grab dinner with your friends, almost all of the time that you are at work in the clinic, in the hospital, on rotation is going to count. If you're writing notes from home, that counts towards your work hours. If you are answering phone calls at night, if you're on pager call from home and you spend 3 hours between 10 p.m. and 6 a.m. answering patient phone calls, that time technically counts towards your total, your 80-hour work hours. Any time that you are required to be in the hospital and the clinic counts. Any time that you are required, either formally or implied, to participate in any educational time counts. So there are some programs that have kind of gotten around some of the work hour rules by saying, well, it's not, you don't have to go to it. It's an optional activity. But if there's even the implication that you have to be there, you should be logging those hours as educational time. So if you have a journal club that happens in the evening, that time counts. If it's part of your curriculum, it counts towards your educational time. If you're attending a conference, be it your regular didactics or anything else, something like this time counts towards your work hours because it's a required activity. Clinical work from home, if you decided to go home after you're done with clinic and have dinner with your family and then write your clinic notes from home that evening, that time counts. So the time that you were logged in remotely in your EMR, you're writing clinic notes, that time all counts. If you are moonlighting, even if it's completely separate from your residency program or your fellowship program, and you spend any time doing any clinical work, be it moonlighting for pay, volunteering in a clinical capacity, that time counts towards your 80-hour rule. Now, the ACGME around moonlighting and volunteering does allow a little bit more leniency in terms of the 1 in 7, but it still counts towards your 80 hours, which means any clinical activity that any one of you are doing has to fall into that 320 hours over a 28-day period. If you go to a conference, so let's say that you have an abstract on at the AAFP meeting and you're presenting and you go to the meeting and you spend 7 hours Monday, Tuesday, Wednesday at the meeting attending lectures, giving your talk, all of the time that you were at that meeting should technically be logged, okay? And all of these hours, again, have to fall within the 80-hour limit. Okay, let's talk a little bit about what doesn't count, because it kind of sounds like pretty much everything you do counts. If you're doing research, if you're writing a paper, you're doing a chart review, you're gathering data, and you're doing that on not as a formal assignment from the program, but you're trying to write a paper to beef up your CV for fellowship applications, research and scholarly work technically does not count towards your work hours. If you're at home and you've got a really great case tomorrow and so you're reading about it, that time doesn't count. If you're studying for your in-service exam or you're preparing an M&M presentation for the following week, if you stay late at work to study because once you go home, you know, you're going to get distracted by your kitchen that needs to be cleaned, that time doesn't count because you're not required to be at work. If you're at the AAFP conference and your day of travel going to there, that doesn't count. The travel doesn't count to get there. And if you're at a conference, I mean, let's say you go to a conference in San Diego, any time that you're at the site, that you're not actually at the conference, you're out to dinner, you're sightseeing, you're catching up on sleep in your hotel, that time doesn't actually count towards educational hours. It's only actually the time that you were at the meeting. A couple of words about at-home call. The 80-hour rule applies for patient care activities. It does not actually apply for home call. So if you go to work all day, you're at work from 7 to 5 during the day, and then you go home and you're on pager call from home from 5 p.m. until 7 a.m. the next day, technically those hours don't count towards your 80-hour limit unless you go into the hospital or you spend a fair amount of time that evening answering patient phone calls or entering orders or talking to nurses. The 1 in 7 rule does apply, meaning if you're in a service that's pager call from home, you still have to have at least 2 days off every week or every 2 weeks. So you have to have every other weekend off. You have to have at least 1 day off each weekend. The Q3 limit does not apply though. But the next line is important because the ACGME leaves a little bit of wiggle room here, both for you and for your program, in that its description about at-home calls states that it must not be so frequent or taxing as to preclude rest or reasonable personal time. So if you're on a rotation that has pager call from home for 10 weeks, and your pager call from home is rough, you get called all night long, you can make the argument that that is unreasonable for personal rest and personal time, and we should probably talk about potentially modifying that schedule. Let's say you're on pager call from home and you get called into the hospital. So you're at home, you're watching TV, and somebody calls you that there's an appy and you go in to do the case. Any time that you spend in the hospital when you go back counts towards the 80-hour limit. So if you get called back and you're in the hospital from 11 to 1 a.m., those 2 hours should be logged as work time. You were in the hospital, you were doing clinical work. If you decide you're going to just stay in the hospital and sleep because it's easier than going home, that time doesn't count because you have chosen to be in the hospital, if that makes sense. I would encourage you to use some discretion when logging the time spent on patient care. You can estimate it. If you get one phone call overnight, you don't have to log that 10 minutes. So if it happens on a regular basis and you actually do start thinking that it's precluding your ability to rest or get reasonable sleep, then we probably need to know exactly how much time you're spending at night taking phone calls. For night float, the night float also falls into the must meet the 80 hours, and it also falls into the 1 in 7 rules. But here's where your specific specialty is going to have specific limitations around the number of consecutive weeks of night float and total months per year or per program. So like the surgery RRC limits you to 16 months of night float over the course of your 60 months of training. Some of the other RRCs have different restrictions there. The good news is your program directors all know these by heart. But I would encourage you, if you get a schedule that looks a little bit odd, to compare it to what the requirements are, because all of us are human, and sometimes mistakes are made in the scheduling. So if you're looking at your schedule and you have an inordinate amount of night float, which, let's be honest, is not amazing for rest and relaxation, completely throws your sleep schedule off, by all means, speak up and talk to your program leadership. I know a lot of folks are really interested in moonlighting. It's a great way to make some additional cash while you're a resident. Please know that whether or not you are allowed to moonlight is up to your program. We have a number of programs that do not allow moonlighting at all during the course of your residency. We have a couple of programs and departments where moonlighting is kind of built into your basic schedule. So it's completely determined by your program. You guys can't just go out and moonlight on your own. Any moonlighting that you do has to be under the approval of your chair, your program director, and technically myself. There's a MAR form, which stands for Moonlighting and Activity Report Form, that basically outlines all of the things that we have to account for if you're going to go out and function as a clinician while you're still in training. Technically, what the Creighton University, St. Joe's, and Valleywise have for you is a training license. And so part of that moonlighting and activity report form covers whether or not you need a full and unrestricted medical license, which you would have to apply for and pay for yourself, whether or not you need to provide your own professional liability insurance or malpractice insurance to be able to moonlight. So that MAR form is basically our checklist to make sure that both you and the institution are covered if you do go out and function as an independent clinician. There is a little bit of a difference between internal versus external moonlighting, and if you have questions on that, again, talk with your program leadership. But the difference is basically if you're a resident who's moonlighting at St. Joe's in your department doing something, that is very different than if you're over at the VA covering their emergency department at night, or if you're covering an urgent care. And again, that MAR form is meant to help kind of terse out all of the various factors that could go into this and make sure that we've checked all of the boxes that we need to check. Please know, though, that any time that you spend moonlighting counts towards your 80-hour limit. The ACGME does not allow interns or PGY1s to moonlight. So even if you had a year prior, thank you, whoever just muted. Even if you've had a year prior of training, you're technically 2 years out from medical school, but you're an intern level, your program level 1, you are not allowed to moonlight. J1 visa holders are not allowed to moonlight. That's a condition from ECFMG and your visa. Please don't put any of that in jeopardy. And importantly, any moonlighting or clinical or medical volunteering that you do here or abroad must not interfere with your ability to achieve the goals and objectives of your training program. So if you're moonlighting so much that you can barely stay awake or come to the hospital prepared for your OR cases the next day, that's not okay. And it cannot interfere with your fitness to work. Again, if you have any questions about moonlighting, I would encourage you to talk with your program director about it, as they're the ones who are generally responsible for certifying that you're okay to moonlight. A couple of miscellaneous things. The 80-hour work rule and the 1 in 7 rules are prorated for vacation and PTO. So if you have a 28-day monitoring period and you have 7 days of vacation in there, you technically only need 3 additional days off. So you still have to have 3 1 in 7 days off for the other 3 weeks that you're working during that monitoring period. Your 7 days of vacation cannot count towards your 1 day off in 7. meaning you can't take vacation and then the program punish you for taking vacation by making you take call every other day. You still have to have 1 and 7 off for your other 3 weeks. And instead of having to work 320 hours in your 28 days, now your limit is 240 hours. So you can't make up for the time that you were away by working extra in those 3 weeks. The rules are prorated for the amount of time that you are present during that monitoring period. A lot of folks have asked about downtime during a shift or a call. So if you come to the hospital and you're on call for 24 hours and there's absolutely nothing going on and you go to take a nap, or you and a couple of folks are watching Netflix in the lounge, if you are required to be in the hospital, that time still counts. So you don't have to say that you logged out or that you clocked out at 1:45 and you clocked back in at 3:30. This isn't a 15-minute cigarette break. The entire time that you're required to be in the hospital counts towards your work hours. There are some specialty-specific requirements and rules. Specifically, emergency medicine has some persnickety rules that surround your didactics. And so I would encourage you, if you've never, go to the ACGME website, click on your specialty, and look at the requirements for your program. They're publicly available. The work hour restrictions for your specific specialty will usually be found at almost the very end of it in the clinical learning environment section. But if there are any specifics around your specialty that are in addition to the basic rules that we've already talked about, it might be worthwhile you being aware of them. Okay, so the one thing that ACGME does allow us to do is put a little bit of flexibility in our rules. But it's important for you to know that flexibility is allowed in specific instances only. And so really the only situations that the ACGME says that we can be flexible, meaning you were on call on a Friday night and you're gonna stay for an additional period of time, are for one of the following reasons. Either care for a single severely ill or unstable patient. Let's say you were on call Friday night and a really bad trauma came in and you were very invested in that patient and very invested in that patient's family, and they are critically ill and you want to stay over your 24-hour limit or your 24+4 limit to care for that patient. You can do that, but it has to be for that patient alone. You have to sign out all of your other patients and essentially hand over all other patient care and only be focused on that single patient. If there's a humanistic attention to patient or family needs, say you withdrew care on a patient and you feel it's very important for you to be there to support that family, that is technically a reason to ask for some flexibility in your work hours. Or if there is a truly unique educational opportunity, and not just man, I need one more breast case for me to hit my defined category minimum numbers, and there's a breast case tomorrow, I'm going to stay for it. Unless it's like a crazy, unusual presentation of a phylloides tumor with lobular carcinoma, I mean, staying just because you have an educational need doesn't necessarily equal a unique educational opportunity. It truly should be something that's going to happen once in your 3 years as a resident or once in your 5 years as a resident. But it's important that even if you want to ask for flexibility in your work hours for one of those 3 reasons, you still have to be fit for duty. If you are so tired that you can hardly see straight, I'm sorry, friends, you got to go home. You got to get some rest. You still have to transition all other patient care. So it can't be that we're a little bit short-staffed, so I'm going to ask for flexibility to continue covering the ICU for a couple of hours until somebody else can come in. That's not a reasonable justification for flexibility. It has to be voluntary. So your program cannot look at you, or an attending in the ICU cannot look at you and say, I think this is a unique educational opportunity, wink, wink, you should stay over. This truly has to be you saying, this is imperative to my education. I want to be a part of this. I'm going to ask for flexibility. The ACGME technically considers PGY1 and PGY2 residents ineligible for this. For a long time, you had to be a senior resident or in your final year of training. But so just know that PGY1 and PGY2 residents technically aren't eligible for this. And this has to be the exception, not the rule. You should literally, over the course of a year of training, maybe have to request flexibility once, maybe twice. But if it comes down to you're requesting flexibility every other week or every other month, that's probably excessive and abuse of this. And note that when you log the work hour violation and you put in the justification for it, be it one of these three things, it still gets flagged in the GME office. And if we start seeing this happen a lot, then we'll investigate what's going on in the program and why one particular program is having so many issues with residents requiring flexibility. To the exception, that's a rule, and it's got to be something that you ask for or volunteer for, not something that you're asked to do. So duty hour or work hour monitoring happens in New Innovations. Every single hour you work should be logged in New Innovations. I would encourage you to develop good habits with staying up to date. Now listen, friends, I know it is a pain in the backside to have to log in and put in your work hours and verify your work hours and make sure they're accurate, but I'll tell you what, every single one of our attendings at both St. Joe's and Valleywise has to fill out a Medicare time study every other month. So some of the logging your hours and keeping track of where you're doing what doesn't go away. I actually keep 3 separate time cards right now, one for Valleywise, one for DMG, and I keep one for Creighton. I would not be surprised if every single one of you has to continue to log your work hours in some way throughout the rest of your career. So I would encourage you to develop really good habits with staying up to date now. Some of the programs allow pre-logging, which means when you get your call schedule for the next month, you can go in and pre-log your hours. In some ways, it's nice because it gives you a heads up if you potentially have a work hour violation coming up. Not all programs allow for pre-logging, but if yours does, I would encourage you to take advantage of this. One of our rules as an institution is that you have to complete your work hour logs for the previous month by the 7th day. So that means that your work hour logs for the month of July have to be completed by August 7th. And the reason for that is we found there was Creighton University actually got audited by CMS a few years ago, and one of the things that was found was some errors in logging and people who were fairly delinquent in getting them logged. And so this is now an institution-wide rule for us, Omaha and Phoenix. Somebody in the GME office start monitoring how many residents have incomplete logs. So if you get a notice from your program coordinator or your program director, or worse, you show up on a deficiency list that I get an email about, if your logs are not complete by the 7th day, we will pull you off of service, which you might think that that's a great free day off, but it actually usually ends up being a PTO day, and it means that you miss out on some educational experience. So here again, develop really good habits, make sure your logs are complete by the 7th day. Please note that if you are on a service or on a rotation that doesn't necessarily involve working most days, let's say you only were scheduled to work 3 days one week. If you haven't logged at least 4 days in that week, it's not considered a complete week and you'll still show up on a deficiency list. So that just means if you're only scheduled to work 3 days, just make sure your coordinator or somebody knows that your work hour logs are complete, but you only worked 3 days that week. For the PTO, this is a change this year. In the past, all of you logged your PTO and your vacation time. Now your program coordinator is logging it, but please make sure that you go in and check it. For internal medicine especially, man, there are 87 of you guys in that program. Your coordinators are awesome, but it's very easy to skip over something or miss something or forget something or be even slightly inaccurate. You guys know your schedule better than absolutely anybody else. So if somebody goes in, if you're going in to log your work hours and your logged PTO hours don't look accurate for what you actually had, please contact your coordinator to make sure that it is. I cannot stress to each of you how important it is to log your hours accurately. And be honest, don't ever lie. This is a big deal. The ACGME started handing out program citations for a single 80-hour any 80-hour compliance on the resident survey that looks like it's less than 90%. They treat this as a big deal. We do too. But I can't intervene. I can't call your program director out if there are problems in your program director, or call your chair and say we need to make some significant changes on your clinical services if I don't have data to support that. And the best data to support that are your work hour logs. I know a lot of residents get into the habit of saying, well, I, for the most part, come in at 6 a.m. every day, and I, for the most part, leave at 5 p.m. every day, so I'm just going to log 6 to 5 every single day. and never put any variation in there. If that's an accurate reflection of the hours you're working, that is perfectly fine. Absolutely, you should log that. But if it's not accurate, don't do it. If it's not accurate, it's basically a lie. And I don't want any single one of you to lie. Just a quick thing on our different work types. Call and conference are kind of obvious. Exceptional circumstance, here's where we're looking for potentially a justification for what would have otherwise been a work hour violation. Home call not called in means you're at home. You're taking pages from the hospital or from your service, but you're not going in at all. Time you're in the OR, time on rotation, work from home. That's if you're sitting at home writing clinic notes that night. Clinic is fairly obvious. Educational leave is if you're at a conference. The home call called in is if you get called in the middle of the night to do a case. Moonlighting, fairly obvious. Any other leave, and then transition of care. That transition is the 4 hours after your 24 hours on that you've logged while you're transitioning care over. Now, here's the thing. This is a lot of different types of work hours. Admittedly, the vast majority of residents will simply put rotation for the hours that they work and not parse out whether it's OR, clinic, etc. To be honest, I could care less how you log your hours as long as I know when you're working and when you're not. If your program has some specific instructions about how you log your hours, please follow those. Your program director, if they feel strongly or if they have a specific need for something, will give you more guidance in that regard. All right, let's talk about violations, because I'll tell you what, even if we do every single thing we can to prevent them, they're going to happen. It helps if you are proactive. So if you are looking at your schedule and you see an upcoming problem, by all means speak up. Contact your administrative chief, call your senior resident, talk to your program director or faculty. If you don't feel like you're getting the response that you should be, you can call me. You can text me and I'll investigate and see what we can do to prevent it happen. But really the easiest way to prevent work hour violations is to look ahead and do everything we can so that they never happen in the first place. You all know your schedule way better than any of us ever will, or understand the challenges that you might be facing. So please self-monitor, look ahead, let everybody who potentially is involved in it know. But I'll tell you, even with the best laid plans, chances are you're going to have a violation at some point. So if you have a violation, let's talk about what we're going to do. First of all, it's totally okay. It happens. Please, whatever you do, do not go in and correct your hours to make it go away. If you worked for 29 hours, do not go in and change it to 24 plus 4 just to make it look like there's not a violation. I need to know that you worked 29 hours. And here's the thing, if that's a pervasive problem in a program, that probably means we need to do some faculty re-education on what that 4-hour transitional period is doing and the importance of getting you guys out on time, okay? So do not correct your hours to make it go away. That's actually probably one of the worst things that you can do. Ask yourself what happened. Why did it happen? Was it a confusion in the schedule? Were you scheduled for a violation? Was there patient care needs, or the service was really busy, or somebody was gone or sick, or you were on the COVID unit and things were crazy and 7 people coded and you just couldn't leave? Those are the things that we need to know in terms of why it happened. And then also ask yourself what we can do to prevent it moving forward. Very important to talk to your chief, your attending, and program director about it. Every single violation that gets logged in New Innovations requires a comment. So I need you, if you have a violation, to go in and submit a comment, an explanation, a justification, some type of post-mortem on what contributed to the violation and how we can prevent it moving forward. But again, friends, I can't stress this enough. Never, ever, ever lie on your work hour logs. Never lie about violations. Honestly, just never lie about anything. But especially here, I need you to be as honest as possible in your work hour logs, and I need you to tell me what happened. So again, don't panic. Submit your comments. All of your program directors or whoever in your program is monitoring your work hours. So like in internal medicine, I believe the chief resident is the one who does the initial monitoring and investigation of work hour violations. They will do their own investigation, try and figure out what happened and what actions can be taken to prevent it happening to you again, to somebody else again. If there are multiple violations, or there are any 80-hour rule issues, the program actually has to submit an explanation to the GEC. The GEC is a graduate educational committee that oversees all aspects of your education on the Phoenix campus. The GEC will then kind of review what happens with your program director and your APD and your program coordinator and see if there's anything either from a system basis that we can correct to help prevent that, if there are program things that need to be changed. The GEC monitors trends. So we put together a quarterly work hour report. So if emergency medicine has 14 violations surrounding conference, well, then Dr. Epter and I have a conversation about shift schedules around conference. That's not a battle any of you have to fight. That's a battle that we fight, but we need the true and honest data from your work hour logs to be able to do so. So a couple of things about fatigue, because really the whole purpose of the work hour logs is to prevent you from getting so fatigued that you can't function, or so fatigued that it really starts to affect your personal wellness and well-being. You guys are going to work a lot. I mean, again, most of the population works 40 hours a week. We're telling you can work up to 80 hours a week. That is 2 full-time jobs, okay? In addition to working, then you're going to go home and read and work on scholarly work and write papers and do amazing, awesome things, but it's a lot. And we want to try and protect you guys as much as possible. I guarantee you're going to get tired. If you're not already, you are going to go through periods of time where you are tired and you feel like your tank is empty. If you're on call and you feel like you are too unfit to care for patients, please speak up, okay? Just because you're on call for 24 hours doesn't mean that you are the martyr and nobody else is there to help you or relieve anything. Your program has to have a way for you to transition care if you are too fatigued to care for patients while you're on shift or not. Things that can help are strategic napping, which I know people joke about and it sounds stupid, but I don't know about you guys, but I'm a napper. Like sometimes you need a nap. And sometimes a 30-minute power nap can make a huge difference in terms of your cognitive ability and how fast you're processing things and your ability to carry on with your patient care. If you feel like you need something like that, speak up. There's a reason why we have sleep facilities in the hospitals for you guys to be able to sleep in, on call, post call, whatever. If you genuinely think that you are at a point where you are no longer physically or mentally capable of taking care of patients, every single one of your programs has a policy on how to transition care when fatigued. I would encourage you to make sure you know where that is and what it says. If you don't know, that's okay. Call your attending, call your program director, call me if you don't know who else to call. But know that you are not on an island. Not a single one of you is the last only person that every single one of those patients rely on. Medicine is a team sport for a reason. You guys are not alone. You're not the only one in the boat. Somebody else can start bailing if need be. If you feel too fatigued to drive home, so let's say you had a crazy, crazy night on call, and it is the following morning, and you walked 22,000 steps according to your Apple Watch, and you are beat to the point where you sit down in your car in the parking lot and you fall asleep. Don't go to your car. Sleep rooms are available for you to sleep. We also have a sleep ride home program that will provide for you free Uber transportation home to get there. Lots of folks will have a friend drive them home. I have driven residents home when they were post-call and too tired. The absolute last thing in the world that I would not be able to live with myself if any one of you got in a car accident on your way home and harm came to you or to someone else because you tried to drive home post-call and were too tired. So if you feel like you are at that point, please know that we have resources available to help you. Remember that the work hour rules are not optional. They're not your fault. People are going to make fun of them and joke about them. One of my biggest pet peeves is when attendings say, oh, when I was a resident, I worked 120 hours a week and walked uphill both ways to the cafeteria to get food in the middle of the night and blah, 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 blah. That's bullshit. Pardon my language, but it is. Them talking about that is the equivalent of me saying to my son, you know, I burned my hand on a hot burner on the stove when I was a kid, but I don't want you to learn from my mistakes. You're going to have to burn your hand yourself to figure it out. Well, that's crap. These rules are not your fault. They were handed on to us by the ACGME. It is our responsibility to enforce it. It is every single person involved in your education's responsibility to make sure that we abide by them. It doesn't matter if you guys don't like them. You may have gotten a full night's sleep and there's a great case that you want to see. It doesn't matter. If you were in-house all night, you have to go home. Doing a case the following morning is unacceptable just because you got a couple of hours of sleep that night. It doesn't matter if other people don't like them. If your attending is pissed off because you have to go home post-call and somebody else has to help them with a case, that honestly doesn't matter. The rules are the rules and we follow them. And if you feel like there's a culture of people not following the rules or skirting around them or doing anything aside from following them exactly as they're written, please come and speak with me and I will look into it. The rules are not open to interpretation. We follow them the way that they are written because the ACGME enforces them the way that they are written. And when it comes to work hour rules, we're really not messing around. We're going to follow them every single time. Please take care of yourself. Again, if you feel like you are not capable of caring, if you're too tired, if something's going on, please speak up. Take care of your colleagues. If something's going on with one of your classmates and you're a little bit worried about them, by all means speak up. They might not even realize that they are struggling or there's something going on until somebody else says to them, hey, are you okay? A couple of final thoughts. Again, be proactive, be honest, be accurate. Please do not misrepresent. Please do not lie. I am all about integrity and doing the right thing when no one is looking. Well, listen, nobody's looking over your shoulder when you're sitting in front of a computer logging hours. And if they are, that's a problem. But do the right thing. Be honest. Do not lie. Log accurately. Having said that, if you don't log it, we may never know. If you are committing work hour violations on a daily basis, but you don't want to log it because you don't want to get in trouble, or your chief resident made fun of you for having a work hour violation and so you're afraid to, I can't do anything about it unless I know what's happening. The hours that you log in new innovations really only come to your program and to the sponsoring institution. But here's where not being accurate in your work hour log starts to really hurt your program. So let's say that you've got a rotation that's a problem. It is a problem. Every single person on the rotation has problems with work hours. But people just decided it was easier to lie on their work hours and not log the violation. Or it's kind of become the culture that everybody goes to an evening conference, even if they're post-call or even if they're over hours, and you don't want to be the one person who speaks up. If none of that gets paid attention to or fixed or remediated or addressed, and then people are filling out the ACGME survey and people tell the ACGME it's a problem, we get violations as an institution, as a program that can affect our accreditation. If the program's not in good standing, it can affect our ability to expand, to seek out new and unique learning opportunities. It can really start to have a negative impact on your education. So I genuinely really need your help. Please tell me what's going on with your work hour logs so that we can intervene on them before it becomes a bigger issue. Again, rules by the numbers: no more than 80 hours averaged over 4 weeks, no more than 24 hours of continuous clinical duty. You can work up to 4 hours for transitional activities related to patient safety after your 24-hour shift, but then you have to have 14 hours off after that. You should have 8 hours off between scheduled activities, but again, we treat that as a must. You must have at least 1 day off in 7, averaged over 4 weeks, and you cannot be on call more frequent than 1 in 3. My final my favorite quote ever, that I genuinely believe if you live your life by this, then everything is just so much easier and simpler. A clear conscience is the softest pillow. If you are lying on your work hours because you don't want somebody to know, or you're embarrassed, or you want somebody to call you weak, that's a problem. So please come to me and tell me if that's it. That is all I have to tell you guys about work hours. I'm happy to answer any questions you have. Again, I recognize that this is not an exciting topic and you probably hear more about work hours than you care to, but I cannot stress to all of you how important this is to your program, to the sponsoring institution, and honestly to each and every one of your wellness and well-being and how we're taking care of you as our learners and trainees. If you have questions, I'm happy to stick around to answer questions. If you want to enter it into the chat, you can enter it into the chat. If you want to take the next 16 minutes to have a little bit of break before whatever is happening at 1 o'clock, your time is yours. But that is all I have for all of you. And if you do have questions that you don't feel comfortable asking in this environment, you can always send me an email. Again, I'll stick around for a while, but otherwise you are all free to go. Happy Thursday. Enjoy the rest of your day. Stay cool and healthy out there, friends. Questions, comments, concerns from any of the folks sticking around? Again, friends, please don't feel obligated to stick around at all. You are absolutely free to go. I'll hang out in case anybody has any questions or other concerns that you guys want to address, but otherwise, enjoy the rest of your day. If you have questions, comments, or concerns, feel free to submit in the chat or send an email. Otherwise, you guys are all free to go. I don't want you to feel like you have to stick around just in case somebody asks a question. All right, folks. Well, if there are no questions or concerns, we will end here. If anything comes up, if you have questions or concerns, by all means, send anyone, myself or someone in the GME office, an email, reach out to us. We are more than happy to help. Otherwise, stay safe and healthy and have a great day, everyone.